There are certain venues where maybe everyone should need to wear a mask. And we've talked about this in schools. And in fact, Governor Cooper talked about this in schools yesterday. In fact, the state recommendation is that local school authorities now can make their calls on masks or unmasks, but that the recommendation from the state is that anyone through K through 8 should be masked. And that's largely because our under 12 kids have not been vaccinated, and we need to make sure we protect them. And that our vaccination rates largely in that age group are frankly not very good, maybe 30%. And that's not good. Now, there are some schools that have actually much higher rates of vaccine penetrance. In fact, I know of some schools that have 80% or more of their students vaccinated. Those schools might be able to approach it a little bit different as far as masking goes, for at least the over 12 people, for the upper grades. If you got 85% of people, then you're surrounded by vaccinated people. It's a lot of layers of Swiss cheese to block vaccine transmission in that setting. So if you're a school and you have high vaccine penetrance, maybe you could start the school year masked and then relax it off as time goes on and things are going well. So I support what the governor said, particularly in those schools that have vaccine proportions or percentages less than 85%. And you know what? The kids are fine with it. Actually, it's the adults that seem to have more problems, particularly the younger kids. They seem to be fine with it. The other thing that was announced by Governor Cooper that I also agree with is modifications of quarantine if two people are masked and there's an exposure. And that they've modified it so that you don't have to quarantine the numbers of people that we did before when that happens. So a mask, and a positive test, you can still let that person come to school who was exposed. The positive test stays home, but the person who is. And then you can do some testing of that person, particularly if they're unvaccinated. Regarding testing now, this fall is going to be a little bit different because so many people are unmasking. Cold and flu season is going to come back. Last year we had a fantastic cold and flu season. We had 0 cases of flu that I know of that were test positive in our health system. This year it's going to be back, and anyone who gets cold is going to have it sorted out, whether it's a cold, is it flu, is it COVID? And you need to do that test because we do different isolation and quarantine for COVID than we do for the other respiratory viruses. So there's going to be a lot more people going to doctors with colds so they can get their test. In fact, most schools are going to require it, that if a child gets a cold, that they have to be tested to come back in. In the past, if a child got a cold, we didn't test them. They stayed home for a day or two and then they could go back to school. So those ambulatory medical centers and those doctors who do outpatient care might want to start thinking and getting ready for that. There's going to be a lot of demand for testing. I call this cold sorting. Get a cold, you got to sort it, just like you sort laundry. Is it the cold? Is it the flu? Is it COVID? And that is going to be also for vaccinated people because breakthroughs can happen and you need to know in that situation as well. So that's what I'm saying. This fall, COVID's going to be a lot of more of an annoyance than it is going to be something scary, except for the unvaccinated people.